Great, thank you and welcome. For those of you here in attendance and for those of you online, I'm glad you could join us for our Mayo Employees Credit Union Medicare presentation. My name is Dave Brown. I am with TrueLink Medicare Advisors, and TrueLink Medicare Advisors is owned by the Minnesota Credit Union Network. Minnesota Credit Union Network is the nonprofit trade association for credit unions across Minnesota. We do advocacy work for credit unions. Any money we make from the Medicare business goes back into doing advocacy work for credit unions in Minnesota. So that's a little bit about us. I've been doing Medicare for 18 years now as an agent, and look forward to doing this presentation with you today and answering any questions. If you do have questions, if you're in person, just raise your hand as we go along. If you're online, just enter it into the chat, and then we'll address that as we go along. Today is an educational event, which means we're not going to be selling anything. We're going to be talking about the basics of Medicare. If you have specific questions, again, feel free to ask that. But it's not a sales presentation. We're here to educate. At the end of the presentation, for those of you here, you got one of these books. If you're online, you'll receive some attachments this afternoon. But in that book is a card. Yours may be yellow. But if you fill this out and leave it with me at the end, if you put your email address on there, I will send you an email just saying, thank you for attending. Do you need help with Medicare? If you respond, then we can set up a time when it's appropriate to meet either one-on-one or however, virtually, however it works for you. If you don't want to meet, I'm not going to keep bothering you. So if you do fill this out, if you have an email address, please list that. I prefer to communicate that way via phone because we always, you know, you catch somebody when you're in the middle of something. So anyway, with that, we will get started. Welcome. We do have refreshments and some handouts back here. In Minnesota, we offer all the Medicare Advantage plans that are available, prescription drug plans, we do most of those, and then many of the Medigap supplement plans that are available. If you're in other states, we're licensed in several states. We can help you. It probably wouldn't be in person, but we can do virtually or by phone if you're in need of help when that time comes. We're going to go over the differences between those types of plans that I just mentioned too in just a moment. So our agenda today is going to be, why would you want to work with TrueLink Medicare Advisors? What is Medicare? What does it cover? What doesn't it cover? We're going to talk about the different enrollment periods, the costs associated with Medicare. What if you're going to be working past the age of 65, or you have a spouse who is and you're on that employer plan? We'll talk about how that works, and then we'll discuss the private insurance options. Around the time you turn 65, your mailbox fills up with direct mail pieces from anybody and everybody wanting to be your Medicare agent. In the fall, especially starting in September next week, a lot of Medicare ads start popping up on any show that you watch, basically. So you can respond to any of those, but we have been vetted by the Mayo Employees Credit Union. We've been working with them for at least 3 years now, I think a little bit longer. And we've been approved. We do a good job for you. So we hope that you're going to use us, but you don't have to. Speaking of that, the Mayo Clinic in Minnesota uses a third-party provider called Via Benefits. If you started working for the Mayo Clinic, or your spouse did, prior to January 1 of 2002, you're probably going to qualify for the Via Benefits reimbursement. And if you do, you need to use Via Benefits in your plan selection, or you won't get your reimbursement. But I still meet with a lot of people who maybe they don't get the best advice they feel from them. So happy to go over with you all the plan options in Minnesota. Even if you don't end up signing up through us, we're happy to help you. We want to be a resource for you. So, but yeah, if you started, you or your spouse started working prior to January 1, 2002, and you worked for the Mayo Clinic in Rochester, then you're most likely going to be eligible for Via Benefits. Our services, there's never a cost for our services. If you sign up for a plan through us, we get paid a commission by the insurance carriers. If it's a Medicare Advantage plan, we get paid the same commission no matter who the insurance carrier is. If it's a Medigap supplement plan, we get paid a percentage of your annual premium. We're here to help you understand and educate you the whys and hows of Medicare. Like I said, we offer multiple plan types. Just because you have a spouse or a neighbor who said, oh, I went with this, they're the best, that might be the best for them, may not be the best for you. If we sit down and talk with you, we're going to ask you for a list, bring your list of prescriptions, what providers do you see, what services do you want, and we're going to help guide you towards a plan that's going to be the best fit for you. We're available throughout the year for questions and assistance. We get calls every day, really. Either issues with signing up for Medicare through Social Security. They've been the worst this year that I've ever seen. I hate to say that, but it's true. Or insurance companies code something, or a clinic bills something wrong, and so the insurance carrier is saying that you owe a copay when you know on your plan you don't owe a copay. You call us. We do a three-way call with the insurance carrier to help you get that straightened out. And then every year during open enrollment, which is coming up in October, if you want to review your plan options for the following year, we'll sit down with you and review those options, because plans can change from year to year, especially the prescription drug plans. So we'll review that for you every year if you want us to help you make sure you're going to have the coverage you need year after year. So there are two parts to Original Medicare. There's Parts A and there's Parts B. Medicare Part A is coverage for hospital, hospice care, home health care, and skilled nursing. If you or your spouse has worked in the United States for at least 10 years, you've had the Medicare tax taken out of your paycheck. That's what helps fund Part A. So if, for most people, that's going to be the case. You won't have a monthly premium to pay for Medicare Part A. Medicare Part B is coverage for doctor and specialist visits, ambulance, medical supplies, outpatient surgeries and therapies, a lot of different areas there. There is a monthly premium to pay for Medicare Part B. This year that starts at $202.90 a month. If you're in the higher income category, we're going to talk about some surcharges that get added on in just a little bit. But this year the monthly premium for Medicare Part B is $202.90. That can change from year to year. Any questions so far?
Do you have this PowerPoint hanging out at all?
We're not allowed to hand this out. You're welcome to take pictures if you want, but because Medicare hasn't approved it, we are not allowed to hand it out. We're allowed to create it and show it, but unless we send it to Medicare, they want to approve the font size, they approve everything. And we're not required to do it, so we don't, because it takes months. But no, you're welcome to take pictures, but we can't hand it out.
Do you have any kind of thing that I can go to Medicare supplement?
Information on Medicare supplement?
Yeah. This is Advantage that you're talking about.
I'm talking about both, Advantage and supplement.
Oh, okay.
Yeah. Yes, sir.
Just a quick question. I know it's $202.90 this year. Already got billed, by the way.
Yeah.
And I haven't used it yet. Well, what was it last year? Or let me ask you this: what is the tendency of it going? Is it like an average of 3% a year? 10%?
What's the percentage of increase each year? A few years ago, it actually went down $9. But this past year was probably the biggest increase we've seen in a long time. I think it was $183 last year, and it went up to $202.90. When I started 18 years ago, it was $56 a month. So it's really risen over the years. But we don't. They say they base it on inflation and some other factors. So.
Thank you.
Yeah, you're welcome. There's things Original Medicare doesn't cover. So Original Medicare is not going to give you coverage for comprehensive dental. It's not going to give you coverage for your vision exams or eyewear or your hearing exams. It doesn't offer worldwide coverage. Original Medicare doesn't give you coverage for prescription drugs or fitness benefits. That's why we're going to talk about some of the plans that do give you coverage for those sorts of things. Another thing Original Medicare won't cover anymore, which a lot of people are surprised by this, they no longer pay for an annual physical. So they'll pay for a wellness exam, and as long as your clinic bills it as a wellness exam, which is height, weight, blood pressure, that's about it, they'll pay for it. If they bill it as a annual physical, depending on the type of plan you have, they may or may not pay for that. And we'll go into a little more detail on that in a little bit. So private health insurance options. There's what's called supplement or Medigap plans. We're going to talk about that. Medicare Advantage plans, also known as Medicare Part C, and there's standalone prescription drug plans known as Medicare Part D plans. With Medigap supplement plans, most states across the country, they have a letter assigned to the type of plan. It might be Plan F, Plan G, Plan N, Plan L. We don't call them that in Minnesota. In Minnesota, they're called basic plans, extended basic. Some insurance carriers have a copay plan, and some insurance carriers have a high deductible plan. With Medigap plans, the benefits do not change from year to year. What they are this year is what they're going to be next year. Unless there's an act of Congress that changes that, the benefits stay the same year after year. The premium doesn't stay the same. They tend to go up every year, but the benefits stay the same. There's no network for most Medigap plans. Any doctor or facility across the country that accepts Medicare will accept your Medigap plan. It travels with you when you leave the state or the country, so if you travel a lot and you're worried about coverage, Medigap plans are going to give you coverage all across the country. And if you move to another state, you're going to be able to keep your Medigap plan from Minnesota. The downside to that is Minnesota and New York have the highest priced Medigap plans in the country. So let's say you moved across the border into Wisconsin, their Medigap plans are about 40% less than what we are in Minnesota for the very same coverage. So you might wish you lost your Medigap plan if you moved. You can still apply for a Medigap plan if you move, but because you're not losing it, they'll ask you health questions if you've been on Medicare for more than 6 months. And if you answer no to all the health questions, then you'll be accepted. If you answer yes to any of the questions, then they'll deny you coverage. So you would either keep what you have or you would look at other options like Medicare Advantage. Like I said, if you're joining a plan after 6 months of having Medicare Part B, then you're going to go through underwriting or being asked health questions. There is a new law that went into effect this month in Minnesota. So up until age 70, if you were to start out with a Medicare Advantage plan, and then maybe you're 69 years old and you decide you want to go with a Medigap plan, there's a law that they have to allow you to join a Medigap plan without being asked the health questions in Minnesota. This isn't true of other states, it's true of Minnesota. It's a one-time option, and if you choose to do that, there's a premium that gets added on, or like a surcharge that gets added onto your monthly premium. So if you were to do that, you're going to pay more than what everybody else would be paying for their Medigap plan, but it is an option for you in Minnesota. Any questions on that? The Medigap plans, like I said, they will not pay for an annual physical anymore. They'll pay for your annual wellness exam, but a Medigap plan doesn't pay for an annual physical. With Medicare Advantage plans or Medicare Part C plans, everything's rolled together for one monthly premium. With the Medigap plans we just looked at, it's a la carte. It's your medical coverage. If you want prescription drug coverage, you have to buy a policy for that. If you want dental or vision coverage, you have to buy policies for those things. With Medicare Advantage, it's all rolled together for one monthly premium. You get your medical coverage, prescription drug, dental, vision, hearing, free gym membership, all of that's rolled together. They all have a maximum out-of-pocket protection for your medical services. So let's say you have some major medical happening where you stay in the hospital a week and you have bills of $100,000. Whatever your maximum out-of-pocket protection is on your plan, some of them it's $4,000. Once you've reached your max out-of-pocket, you don't have to worry about whether your bills are hundreds of thousands of dollars. Your insurance carrier is going to pay 100% if you reach your maximum out-of-pocket. Medicare Advantage plans do have a network of plan providers, and those networks, Medicare Advantage plans differ greatly from one state to the next. In Minnesota, we really have the strongest plans in the country in that we have insurance carriers where 97% of providers are in their network. The two Medicare Advantage insurance carriers that the Mayo Clinic in Rochester still accepts is Blue Cross of Minnesota and Medica. They still take Medicare Advantage plans from those. The other carriers like Health Partners, United Healthcare, Humana, they no longer accept those plans at the Mayo Clinic. There are two types of Medicare Advantage plans. There's an HMO and there's PPO. If you go with an HMO, which stands for Health Maintenance Organization, you're going to be limited in how you can use it if you're traveling outside the network, and you may need a referral to see a specialist. Most of the Advantage plans in Minnesota are no longer HMO plans. HMO plans, I know we have people from Florida and Arizona online who work at the clinics there. HMO plans are really big in Florida and Arizona, and with those you just have to be careful. They may work well for you, they may not. The network's far more limited on those plans than it is on the PPO plans. PPO plans in Minnesota, like I said, some carriers offer 97% of providers in network, and they travel with you if you're traveling across the country. They all have some sort of a national network where if you're traveling, you're going to have in-network coverage across the country. Medicare Advantage plans do not move if you relocate even to another county or to another state. So if you were to move across the border to Wisconsin and you have an Advantage plan, you have the option then of going with a Medigap plan in Wisconsin or Medicare Advantage plan in Wisconsin, and you don't need underwriting to do that if you lose your plan because you moved if you have a Medicare Advantage plan. You can enroll anytime in a valid enrollment period. The benefits can change from year to year on a Medicare Advantage plan, and the premiums can change from year to year on Medicare Advantage. Any questions on that? Okay. Then if you go with a Medigap supplement plan and you want prescription drug coverage, there's what's called Medicare Part D plan or prescription drug plan, standalone prescription drug plans. Each insurance carrier has a formulary or a list of prescriptions that they cover, and that's why if we meet with you, we ask you to bring a list of any prescription medications you're taking that you would get at the pharmacy to look up to make sure whatever plan you go with, that your prescriptions are going to be covered. They all offer some sort of mail order service, and they all have different tiers of coverage. Typically, tiers 1 and 2 are going to be generic medications. Some insurance carriers add on a tier 6, which is the really low-cost generic medications. Tiers 3 and 4 are going to be brand name medications. Those are going to be things like Ozempic or Jardiance or Eliquis, things like that. And then some people may have a tier 5 specialty medication. Those are going to be the highest priced ones. If you did not sign up for prescription drug coverage when you go on to Medicare, I've been doing this 18 years and I've had clients over the years who say I don't take any medications and I never will. And for some that's been true, and for others they come back 5 years later and they say, oh, my doctor prescribed me a medication, I want to sign up for prescription drug coverage. So if you go with Medicare Advantage, that's included. If you go Medigap supplement, it's not. But if you choose to do that, then you're going to pay a penalty for the number of years you went out without coverage. That penalty gets added onto your monthly premium, and you're going to pay it every month for the rest of your life. So there are some low-cost options. In Minnesota, you can get a prescription drug plan for $5 a month. In other states, you can get one for $0 a month. So there are some low-cost options where even if you're not taking prescriptions, it is a good idea to sign up for your plan when you first go on to Medicare. Yeah. Any questions on that? Okay. The government started something new last year that's called the MP3 or the Medicare Prescription Payment Program. There's no cost to join the program, and whatever plan you sign up for, they're going to send you information on this. But I meet with people who are on some very expensive medications and they reach their maximum out of pocket by February for some. We didn't used to have a maximum out of pocket on prescription drugs. There used to be something called the donut hole, where if you fell into this coverage gap or the donut hole, you had to pay 25% of the cost of your medications. That's gone away. This has replaced it. This year, the government has capped everyone's medication costs at $2,100. Next year, it's going up to $2,400. But that means whatever prescription drug plan you're on, as long as your prescriptions are in their formulary, if you reach this cost of $2,100 before the end of the year, you no longer pay anything for your medications. The insurance carriers have to pay for your medications. Some people hit that threshold by February or March, and once you're retired, it can be difficult to come up with that kind of money for some every year for that. So this prescription payment program was started to where if you sign up for it, your cost of your prescriptions are spread out over 12 months instead of getting hit hard the first couple of months. And when you go to the pharmacy, you'll pay nothing for your medications. If you sign up for this, your insurance carrier will bill you each month for your medications. Any questions on that? Yes?
So I did sign up for one already.
Mm-hmm.
And it's for the ARP medical RX.
Mm-hmm.
$5.
Yep.
2100 was mentioned. So they're going to send me stuff about this once I become eligible for that?
They will, yes. Yeah, the question was, he's already signed up for a prescription drug plan. Will the insurance carrier send him information? Yes, they will. And you're not required to fill it out. It's only if you want to be a part of this program.
It sounds like I should be.
If you're hitting your maximum out of pocket pretty quickly into the year, yeah.
I probably won't.
Yeah. So otherwise, you just pay for your prescriptions at the pharmacy, and once you hit your maximum out of pocket, that. But if it's going to be a financial challenge, it's really for those people. The government started this last year. Less than 10% of the population even took advantage of it. But it's out there for those people who it might be a real struggle for them to pay for their prescriptions if they get hit hard those first few months of the year. If that's not you, or if you're just not interested, you don't have to sign up, but you can if you want to.
But there's no, but there's no disadvantage for signing up.
There's no disadvantage. If you do sign up, your insurance carrier will bill you each month for your medications instead of you paying for them at the pharmacy. Yeah.
That's good to know.
Yeah. Yes.
Is this a one-time thing if you sign up, or is it, if you run into your maxes and you decide, oh, this would be a good idea for me, then you can sign up at that time?
You can sign up later, yes. You don't have to do it right from the outset, yes. Mm-hmm. Yes.
Once you sign up, you are signed up.
Once you sign up, you're signed up unless you fall out of the program. Yeah. And we have a question online.
Yeah, someone's asking, can you sign up for M3P if you have TRICARE for life?
You would need a Medicare prescription drug program to do that. If you have TRICARE for life, you do not want to sign up for a Part D prescription drug plan because that can interfere with your TRICARE for life. You can sign up for a Medicare Advantage plan if you have TRICARE for life that offers coverage for medical but not prescription drugs. In Minnesota, there are plans, I work with a lot of veterans or who have TRICARE for life who sign up for a Medicare Advantage plan in addition to their TRICARE for life, because there's a zero premium for the plan. It includes dental benefits, vision benefits. They pay back $135 each month on your Part B premium. They're just rich in benefits, but it doesn't interfere with your TRICARE for life. Those Medicare Advantage plans also don't offer prescription drug coverage. So again, to your question, no, you do not want to sign up for a standalone prescription drug plan if you're on TRICARE for life. Yes?
And so I still working if I'm past 65, what should I do?
Well, if you're still working, we're going to talk about that in a moment, but if you're on an employer plan, you can delay your Medicare until you're ready to retire.
But you still enroll Part A, isn't it?
You can enroll in Part A if you want to. If you enroll in Medicare Part A, if your employer plan, if you're contributing to a health savings account, you can no longer contribute to your health savings account. So if you're contributing to an HSA and you're still working beyond age 65, you don't want to sign up for Part A or Part B. If you're not contributing to an HSA account, you can go ahead and sign up for just Medicare Part A if you're still working.
And which way is more benefits for?
Which way has more benefits? Your employer plan is going to pay first. Part A would be if you went to the hospital, they might pick up something that your employer didn't pick up. Maybe you had a deductible or something. But even with Part A, if you go to the hospital, you're going to have a deductible of over $1,700. So it's easier, I think, when you're ready to sign up for Part B, if you already signed up for Part A at age 65, than if you didn't, but it's your choice. There's not a huge difference between whether you do or don't. If you do, you can, yeah. There is a new program that just started July 1st regarding prescriptions. It's called the GLP-1 Bridge Program. So if you're taking for weight loss, it's not for if you have diabetes or severe sleep apnea, but if you wanted to take a GLP-1 for weight loss and you meet the criteria, if you have Medicare Part A, you can sign up for just a standalone prescription drug plan. And if the government approves it, it has to be pre-authorized by Medicare. You can get a GLP-1 like Zepbound or I forget the other two. There's 3 options, but you can get them for $50 a month if it's approved. That would be another reason if you had Part A and still on an employer plan, you could sign up for an inexpensive prescription drug program if you needed a GLP-1 for weight loss. Yes?
This may be outside, and you may have to redirect me on this, but you mentioned HSA accounts.
Yes.
Those are the ones generally you contribute to them, and then you pay your medical expenses from that account. That becomes pre-taxed or something like that, where it doesn't get taxed.
Right.
Well, now that I won't be employed anymore, I won't have that option available. I was wondering, here's my question. Would I just go to my bank and set up an account like that? Or would I go to my financial advisor and set up an account like that?
Yeah. You're asking, would you, since you're no longer working, how could you set up an HSA account?
Correct.
Well, if you're on Medicare Part A, you don't want to, because it takes away all the tax advantages. Once you sign up for Medicare Part A, if you're contributing to an HSA, it will tax whatever you're contributing, which destroys the whole point of it, and they'll treat it as income for you.
Well, mine's different. I guess what I'm saying, what I did is at the beginning of last year, for example, I said, I'm going to set aside $2,100.
Yeah.
And they just take it out of my paycheck.
Yes.
Okay, and that's what I have now.
Okay.
Is that the same thing?
If it's an HSA, there's also HRA, health reimbursement. There's different types of plans. If it's a health savings account, then once you sign up for Medicare, you're losing the tax advantages if you keep contributing to an HSA.
So, okay, to finish my question then, if I may.
Yep.
I don't mean to dominate this. So, in other words, from this point on, for example, I got billed for my Part B already, $680.70 or something, and I paid it already.
Yeah.
I don't even start till October. But what I'm saying is, so that money that I had to pay was already taxed, my taxable money that I got from my payroll, right? There's no special earmark or anything anymore for that. I pretty much am just gonna have to pay taxes on all of that medical expenses. Right?
Well, if I'm understanding you correctly, you can contribute to an HSA up until age 65, and you can continue after that age if you're not signed up for Medicare Part A or Part B.
But I am.
But you are. So you're going to get taxed on your contributions to your HSA account, and if your employer contributes anything towards an HSA, they're going to start treating that as income, which you're going to pay taxes on too.
So I don't need to, so I guess the bottom line is I'm just gonna, the expenses are not gonna be pre-taxed anymore.
That's right. There's really no point in setting up an HSA once you're on Medicare A and B.
Okay, thank you.
Yeah, you're welcome. The different enrollment periods. Your first enrollment period is called the initial coverage enrollment period. It's a 7-month window. It starts 3 months before the month you turn 65, the month of and 3 months following. This is the time frame around your 65th birthday in which you can sign up for Medicare Part A and B, an Advantage plan, a Medigap plan, whatever works for you. However, if you're still working at age 65, or maybe you're retired but you have a spouse who's still working, and you're on their employer insurance plan, you do not have to sign up for Medicare at age 65. You can sign up for just Part A if you want to, but you don't have to. And you don't need Part B if you're going to continue to be on an employer plan because either you or your spouse continue to work.
I would have a quick question. And so if you don't sign up for that, you get penalty?
Yep, there's not a penalty if you if you don't sign up for Medicare Part A and B at age 65. Once you are ready to sign up for Medicare Part B, if you're beyond age 65, there's a form your employer or your spouse's employer fills out for each of you that verifies you had coverage, and that gets submitted at the same time you apply for Part B. That prevents any penalties for not signing up at age 65.
Thank you.
You're welcome. Yes.
Just to share with you, young lady in front of me here, that's exactly what I went through.
Hmm.
I was past 65, I'm retired now from Mayo Clinic. I was past that 65, so I had to get a special form. I think it's L564.
Yes. Mm-hmm.
And then you just go to your human resources, they fill it out for you, they say how long you've been employed, and if it covers the point that you are past 65, which it is, then you get no penalty.
Yeah. And I have a slide on that we'll look at in just a moment too. But no, thank you. I appreciate the input. When you are ready to retire, or your spouse is ready to retire, when you're beyond age 65, there's what's called a special election period. And you want to start this 2 to 3 months before your retirement's going to start. You do have 8 months once from the time you retire to sign up for Medicare Part A and B without a penalty. However, you don't want to go 8 months without coverage if you're Medicare eligible. And if you're going to sign up for a Medicare Advantage plan once you retire, you only have 63 days in which to do it. But just so that you don't have any lapse in coverage, we can help you with your planning 2 to 3 months before you're ready to retire. We can work with you on getting signed up for Medicare Part A if you haven't done that already, Medicare Part B, and in your plan selection. So that's what the special election period is for. And then every year, once you're on Medicare, there's the annual election period, and that runs every year from October 15th through December 7th. We're coming up on that pretty soon. This is a time, if you're on Medicare, you can review your coverage. If you're on a Medicare Advantage plan, you can look at other options or at least review your coverage if you want to. A standalone prescription drug plan, you can review that, and we're here to help you with that. And if you do make a switch during this time frame, then it goes into effect January 1 of the following year. If you're on a Medicare Advantage plan, then there's also one more time you have to make a switch, and that's every year from January 1 through March 31st. If you choose to go the route of Medicare Advantage plans, let's say you didn't review your coverage, you thought, I'm fine with it, I know it's going to work well for me. You go to the pharmacy in January and find out that your plan no longer covers one of your expensive medications they used to cover. You don't want to keep paying for that through the rest of the year, so you have one more option to look at other Medicare Advantage plans and switch to that. It would go into effect the first day of the following month of whatever month, January through March, you did it. Or you can just drop one altogether and go back to original Medicare, which isn't a great idea, but you can do that during this time frame. Yes?
Sorry, thank you so much.
Go ahead.
I've done all this already. Okay, so I am currently set up for a Medicare program.
Okay.
Blue Shield Blue Cross, $195 a month.
Yeah.
Rather expensive, like you indicated. My question, and it hasn't kicked in yet, it doesn't
Mhm.
start until October. Now, you mentioned that there is an Advantage plan called Medica.
Mm-hmm.
That's what I'm currently on now with Mayo Clinic.
Yep.
And I'm wondering if maybe, let's say I decide to change my mind and go with the Advantage plan for Medica, okay? And then let's say they change or nope, we're no longer going to cover Mayo Clinic because other plans have done that in
Oh.
the past. Would I have the option to switch back, or not back, but well, in this case,
Yeah.
since I am, even though it hasn't kicked in yet, I
Right.
am part of that Medicaid program.
Right.
Could I start out with Advantage and then switch to the Medigap at a later time if something happened to me
Yeah.
with the Advantage plan?
So the question is, how do you switch back and forth between Medigap and Advantage plans? So yes, Medica offers your plans for Mayo Clinic here in Minnesota. They also offer Medicare Advantage plans and Medigap plans. And the Mayo Clinic in Rochester still accepts those Medicare Advantage plans. There may come a time when the clinics in Florida and Arizona do not take Medicare Advantage plans. There could come a time when Rochester Clinic no longer takes Medicare Advantage plans. I don't know. That's an internal decision, but right now they do. So if you started out with that copay plan that you have, And then let's say a year later you want to try Medicare Advantage. You can leave your Medigap plan for a year if you want to try a Medicare Advantage plan. If you're not happy with that Medicare Advantage plan after a year, you can go back to the Medicare Medigap plan that you had without any health questions. Like I said, you have up to a year. If you want to go back to that Medigap plan, you can. If you don't want to, then you keep your Medicare Advantage plan. Let's say 2 years later, you're unhappy with your Medicare Advantage plan. If you want to go back to Medigap, if it's been longer than 12 months, then you'll be asked health questions. And if you can answer no to all the health questions, then you can go back into Medigap. If you answer yes to any of the questions, you'll be denied coverage.
You just don't get a chance.
No.
Okay, one last question.
Yes.
It hasn't kicked in from a Medigap yet.
Mm-hmm.
It sounds like I may want to look at this Advantage plan since I'm doing all my stuff through Mayo Clinic anyhow.
Yeah.
And what I'm saying is, since this hasn't kicked in yet, can I change that? They haven't even approved my application yet.
Yeah. You can. When would it be effective? October?
So,
Yeah. Because the new plan information for next year comes out October 1, it might be worth you having the plan you chose right now through the end of the year, but then also if you wanted to meet and go over what Medica's offering next year for if you're in Olmsted County.
keep things in place for this year.
Yes.
And then once it's been, make the plans for the following year now. If I did want to switch over, I can just go ahead and do that.
You could, and it would go into effect January 1. Yeah. Yeah.
Thank you.
Yes.
Mess up is that Medicare and Medicare supplement is the same? Or different?
So Medica is an insurance carrier from Minnesota, based in Minnesota, and that's who the Mayo Clinic uses in Minnesota to offer your health insurance plans if you're a Mayo or your spouse is a Mayo employee. Medicare is the federal government organization.
No, I mean Medicare Advantage, okay, and Medigap
Yeah,
and Medicare supplement. What the difference between three of them?
okay.
Because I
So,
thought, when you're talking, I thought Medicare Advantage, that's a one plan different. Medicare supplement and Medigap
Okay.
the same. Is that
so,
right?
so yes. So your question is, what's the difference between Medigap, Medicare Supplement, and Medicare Advantage?
Yes.
Medigap and Medicare Supplement is the same thing. Some people call it Medicare Supplement, some people call it Medigap. It's the same thing.
Okay.
Yeah.
Thank you.
You're welcome. You guys have good questions. So what if you delay your Medicare benefits because you or your spouse is going to work past the age of 65? We can help compare your costs of going on to Medicare versus the employer plan. From what I know about what Mayo offers their employees here in Minnesota, you're better off to stay on the Mayo plan than you are to go on to Medicare, but it's your choice. Mayo's plans are deemed creditable by Medicare. And again, if you're contributing to an HSA, you do not want to sign up for Medicare Part A if you're going to continue working past the age of 65. If you have a spouse who they're not the owner of that HSA account, it's the employee, they're not the employee, they can sign up for Medicare Part A if they're 65 and not have to worry about the HSA contributions. But it's the one who's contributing from their paycheck into the HSA account. If that's you, do not apply for Medicare Part A yet. When you are ready to retire, the rule is stop contributing to your HSA up to 6 months before you're going to go on to Medicare. So let's say you're age 66 and you think, I'm going to retire sometime next year. The rule of thumb is when your plan options come out, generally in November, just choose to stop contributing to your HSA account in January for the following year. And then if you retire July or later, you're not going to be taxed on those HSA contributions. It's not a huge tax, but it takes away the benefit of being tax exempt. If you retire in February, then they're going to go back 6 months and you're going to pay tax on whatever contributions you made if you're beyond the age of 65. Did that confuse everyone? Or? Okay. When you're ready to retire, you can apply for Medicare Part A and/or Part B. There's different ways to do it. You can do it online. If you've ever created an account for yourself on the Social Security website, you can log into your account and apply for Medicare Part A or Part B. You can go to your local Social Security office, or we can help you fill out the forms and we can fax them in. Like I said, this year, Social Security, it's been the worst I've seen it in 18 years. And what I've started telling people is, go to your local Social Security office. It's the biggest inconvenience, but right now, numerous clients that we've faxed in, they're not getting their Medicare Part B dates right. They're doing it for February of next year, which they wouldn't even do it this early. They're losing applications. They're sitting there for months not getting processed. So if that's you, when you're ready to retire, the quickest way, the safest way is to go to the local Social Security office and to apply for Medicare A and B through them. There's just been more problems this year than I've ever seen. Yes?
I actually went through that whole process.
Okay.
And they recommended exactly what you did. And the best thing I ever did when I finally, and they tried to talk me out of going to the office time and time again.
Yes.
Are you sure you really need this? You already know what you're doing, kind of thing, right?
Yeah.
I said, no, I want to go in just to make sure it's okay. And I'm glad I did, because when I went into the office, I said, this is where I'm at, and this is when I'm going to retire. And he goes, oh, is that what you're going to do? Well, let me go ahead. I'll just grab that case and I'll approve it right here.
Yeah.
But it would have sat there for 3 months otherwise.
Yes.
So it's in your best interest to sign up with the local office.
It is. I was on the phone with a lady yesterday for over an hour with Social Security. She wanted it to start August 1. We did it in June. We applied in June. They still haven't approved it. And now she's been without insurance for a month. And they won't, that's like, they act like they don't care. A lot of them do, but just go into the office. Yes.
And I still working, but can I just go ahead and apply for that and delay it? And so make sure I don't get penalty, because I'm just worried, I forgot about that.
Yeah.
Because I still working, right?
So if
And
you're,
so I just apply, but delay that part.
so no, if you apply for Medicare Part B, if you're beyond,
A.
oh, Part A, yeah, you can go ahead and apply for Part A.
But delay part B.
You can delay Part B, yes.
Yeah, and so just go ahead and do that, and I don't want to forget about that. And I
Yeah.
know this because we go to the male retirement class, they're talking about that. You delay, you don't do that, and later on you get penalty for the rest of your life.
Yeah.
But that's
So you'll only get a penalty for Part B if you don't sign up at age 65, if you or your spouse are no longer working. If you're age 65 and you're still on an employer plan, and it's through whichever one of you is still working, you're not going to pay a penalty down the road, because as long as your employer fills out the form that we're going to look at, this form here, as long as they fill this out and you submit this form at the time you apply for Medicare Part B, that prevents you being penalized for not signing up at age 65. And it is a CMS L1564 form. Yeah, so the employer fills out Section B, you fill out Section A, and again, submit this when you apply for Medicare Part B. You won't get penalized for not signing up at age 65. You don't need Part B if you're on an employer plan. You don't need to be paying over $200 a month for something that serves you no purpose.
But if you delay that, you still pay? You don't need to pay for that.
You don't need to pay for Part B until you're ready to retire and leave your employer plan. Yes.
I got my bill because I didn't come here early enough to listen to your presentation. So yeah, I'm not retiring yet. I did sign up for Part A, but I also signed up for Part B, and here's my bill.
Okay.
Can I just go on SS website and cancel Part B?
You can suspend it.
Okay.
And you probably need to call, you can either call the local number to the Rochester office or the national number. If you call the national number, you're going to be on hold for a while.
It seems like they roll you to a national
They do.
switchboard anyway.
If the local office is busy, you get sent to Kansas City or Dallas or somewhere.
Okay.
But you can suspend it because you don't need to be paying that if you're still working.
Thank you.
You're welcome. There are income impacts once you're on Medicare. There's something called extra help for those people who are going to fall into the low income category. It may not be you, but I've worked with people, especially people in their late 70s or 80s who tell me, I can't even afford my Part B premium anymore. And I'll ask them, have you ever applied for extra help? They don't know anything about it. It's a government program that's available based on your family size. The percentages across the top are the percentages of the federal poverty guidelines. Based on your family size, if your income is below whatever those levels are, you most likely will qualify for some sort of extra help. If you qualify, it's going to lower the cost of your Medicare Part B premium and your prescription drug costs. So to apply, you can either go online to ssa.gov/extra help. You can meet with your County Department of Human Services. They can help you fill out the form. But if you're in that situation where your income's just really dropped, you may qualify for extra help. The other side of that, yes.
Go back to reverse, and I misunderstand. Okay, the family size 1, that means one person?
One person, just you and your family, yes.
If my family, just myself, and so how much the income I can apply for help?
So if it's only you and your family, you don't have a spouse or kids living at home or anything, these are last year's numbers, but if your income was under $22,590 for the year, then if you apply for extra help, you're probably going to be at some level of receiving extra help. If your income's over that amount, you're not going to get extra help.
Thank you.
You're welcome. The other side of that is if you fall into the high income category, and this is the government's definition of high income, but every year once you're on Medicare, the government or Social Security works with the IRS to look at your federal tax returns from 2 years ago. And they're going to be looking at your modified adjusted gross income. This year, these thresholds tend to go up every year, but if you're an individual and your modified adjusted gross income 2 years ago was over $109,000 for the year, or if you're married filing jointly, if your modified adjusted gross was over $218,000 for the year, then they're going to add on a surcharge to your Part B premium and your prescription drug premium. So you can see by this chart, if your modified adjusted gross from 2 years ago, if you were to sign up for Medicare Part B this year, let's say your modified adjusted gross was $300,000. Instead of paying $202.90 a month, you're going to pay $405.80 a month, and they're going to add $37.50 onto your Part B premium every month for the rest of the year, and then every year they reevaluate it and adjust it according to whatever your modified adjusted gross was from 2 years ago. I get asked a lot, well, they say, I inherited a house or I sold some property or something. Oftentimes, if it's a one-time event like that, you can appeal if the government tells you that you have to pay this surcharge. If it's a one-time event, you can appeal it. You may have to appeal it more than once, but oftentimes they'll grant the appeal and you won't have to pay the surcharge. If it's just based on regular income and investments and taking distributions and that sort of thing, they're most likely not going to grant the appeal. But a lot of people aren't aware of this, and it's something you need to be mindful of. Yes?
But this one I'm talking about your income, but doesn't count in the account of Roth IRA, isn't it?
The what?
Roth IRA.
Oh, yes. If you have income from a Roth IRA and it's on your tax returns, that's going to count towards your modified adjusted gross.
Okay. Thank you.
Yeah. Yes, sir.
What if you are rolling from a 401k to a Roth?
Yeah.
Will that show up as?
Anything that counts towards, like adjusted gross, modified adjusted gross, they add back in the 401k and the Roth and all that. So if that applies to you and it puts you over the threshold for whatever the threshold is each year, then yes, they'll add on the surcharge.
So I should keep to work until I'm 70 because I'm just slowly to grow over.
Yeah.
I don't get that's $400 or $500 by every month.
Yeah. So these thresholds tend to increase every year, but yes, I want to make you aware of it because a lot of people aren't aware. They might take distribution 2 years before they're going to go into Medicare, and that's the worst timing in which to do it. If you can do it 3 years before, then you're good, I guess. But okay. So kind of wrapping it up here, we know that Medicare Part A, whether you go Medicare Advantage or Medigap, you won't have a premium for Part A. Medicare Part B for most people is $202.90 a month this year. Medicare Advantage plans start at $0 a month and can go well over $100 a month. But again, that's everything together. Your medical, prescription drug, dental, vision, hearing, all those benefits roll together. If you go Medigap, there are plans, high deductible plans in Minnesota. Those start around $70 a month or a little less. If you go with what's called a Plan G in other states, that's going to be well over $300 a month, so there's a range there. That's just your medical coverage. You would want to add on prescription drug coverage. In Minnesota, that's going to run anywhere from $5 to over $100 a month. And then if you want dental and vision coverage, you have to buy policies for those too. So you're typically going to pay more in monthly premium than with Medigap than you would Medicare Advantage. But there are reasons why people go with Medigap. I don't discourage you going either way. I help you talk through it to help you decide which route is going to be best for you. There is no one best for anybody. It's what's best for you. And we have a question online.
Yeah, if your spouse is younger and will still be working, should I not file jointly?
That would be a question for your tax preparer. I'm not allowed or qualified to give tax advice, but that's a very good question actually for your accountant or a tax attorney or somebody. I would assume they're experienced with that and they would be able to give you good advice. Yes?
So the amount here, A, B, gap, and Part D, 285, that's the maximum for people, only the income less than 109, is that correct?
Right, yes. So
Your income higher than that, and
you're going to pay even more, yeah.
B will be 400 something.
Right,
remember,
yeah.
because
So let's say your Part B is 202. If you went with what's called Plan G in other states, in Minnesota that's going to run you about $330 a month. If you get a Part D plan, whatever that range is going to be, if you add on dental and vision, you're going to be looking at around $400 a month versus a plan Medicare Advantage for about $150 a month. But again, it's your preference. It's what you want that works for you.
And so that Medigap, if you go to international travel, then you have a sick outside the country, and so is that covered for Medigap?
So question is international coverage with most Medigap plans, not all. Most Medigap plans are going to give you some international coverage. Medicare Advantage plans are going to give you international coverage. How it works is it has to be deemed a medical emergency. So you pay the bill up front when you're in another country. When you get back, you submit your expenses, and depending on the insurance carrier, they'll reimburse you either 80 to 90% of your costs if they determine it was a medical emergency.
Thank you.
You're welcome. Okay, so again, if you fill out this card and leave it, if you have yellow ones, you're not required to, but if you fill it out and leave it, I'm just going to send you an email saying thank you for coming today, and I'll ask you, do you need help with Medicare? If you respond, then we'll follow up. If you don't, I'm not going to keep badgering you with that. But we appreciate you coming today. I have contact information here for those of you online, a direct phone number, our 800 number, and some email addresses. And again, you'll get this sent in an email attachment to you by the credit union this afternoon. But any final questions? Yes?
Just a review, so if I decide, I've got to look into this after I'm gone. I'm going to check out VI benefits.
Yeah.
That's something that the clinic provides for us.
Yes.
And that's where I got this information.
Yes.
I was adamant on the Medigap because I didn't want anything to change. I don't, I like that security,
Yeah,
but it's pretty expensive.
it is.
And I have to get a Part D to go with it, which isn't too bad.
Right.
However, if I decide to go with the Advantage plan after I review with them, after I get back home, then I won't need the D either.
That's right, it's all together. Via Benefits, as of last year, they weren't contracted to sell Medica plans in Minnesota, so they never bring it up with people because they don't,
Even ask them about it.
they aren't contracted to sell Medica. This year, they were allowing us to help mail retirees and sign up through us and still offer their reimbursement, that may change for next year. It's not an ongoing agreement, but the reason that is when Mayo announced they were no longer accepting United Healthcare or Humana, it reduced people in Olmsted County down to two options, Medica or Blue Cross. Well, they were, of course, Mayo was getting a lot of complaints that Via Benefits only offered Blue Cross, and Blue Cross has one option for Advantage plans in Olmsted County this year. So it kind of forced Via to come out and say, well, this year we'll allow you to sign up through another agency. And I'm happy to work with people. I tell people that's probably going to change next year, and if you sign up through us this year and want to continue to get your reimbursement ongoing, it's a paperwork nightmare for you. So yes, I would love your business, but I don't want you to have to go through that.
Maybe hearing from me.
Okay. And then last slide, this is our agents, our team for Medicare. So no more questions online, Mike? Okay. All right, well, I'll be around afterwards. If you do have questions, again, if you fill out the card, leave that with me and I'll follow up with an email. So thank you for coming today.
And so I still working, and so I don't need to do anything.
You don't need to do anything yet, no.